Well, today I want to talk about selecting the proper impression tray for your ideal final impression. It is critical to select trays based upon a per patient's need basis and stray away from the habit of simply picking trays that are readily available at that time. A little pre-planning is going to go a long way when it comes to the quality and fit of your patient's final restorations. I would like to go ahead and show some examples of recent patients seen in my operatory and talk about the reasons why we chose their specific trays. So in the case of this patient, we decided on a full arch metal tray for number 30 due to the lack of posterior support, since number 31 and 32 were missing. We do not want an opportunity for the bite to collapse. Of course, an opposing full arch impression and a bite registration will follow after the final impression. The main benefit of a metal tray, of course, is its rigidity. It will not bend and warp your impression, even through pouring up and models. In this case, however, the patient had some bony exostosis apical of the lower anteriors, which momentarily locked the tray to the arch. In hindsight, a custom tray that relieves undercuts may have been a better option. It is for this very reason I want to reiterate my rule of checking and double-checking prior to tray selection. As you can see, once removed, this impression is very serviceable and the patient's restoration was a success. So here we have a similar situation. Both molars are prepped and no posterior stops are here to prevent bite collapse. In this case as well, a full arch is necessary. By planning ahead, checking for undercuts, we verified that none were present and the tray was removed with ease. This patient has a very unique arch anatomy. It is very tight and oblong with an extremely deep palate. We tried a multitude of pre-sized trays, however none would fit his arch shape without being warped or bent. Of course, I always avoid warping or bending final impression trays. Interestingly enough, I did have to warp a plastic pre-sized tray just to take the impression for his custom tray. Then I had a couple custom full arch trays made in case of any retakes. I prefer custom trays with holes placed in the acrylic for extra ability to lock impression material to it. As a rule, try your tray in the mouth prior to impression and make sure the walls of the tray do not invade too much into the mucobuccal fold. If needed, adjust your tray with an acrylic burr if you find this to be an issue. After all, your lab tech is merely working off of a model and doesn't have the ability to see folds or tissue. This number 27 anterior crown impression was fairly straightforward. When it comes to an anterior, most times less is more. A triple tray impression made this capture easy to fill, bite, and remove. Notice I selected a metal rimmed tray versus a plastic tray due to the rigidity of this material. This impression was successful on our first attempt. In your search for a great assortment of pre-sized trays, I like to suggest GC America products. As far as selection is concerned, if you're not using a custom tray, you'll find what you're looking for there. Well, I hope you enjoyed a different perspective on impression tray selection. I want to leave a lasting impression on you with these two very important points. Make sure to plan ahead and on a per patient needs basis, and mimic the tray you'll use for the final impression with the one that you will use for your permanent restoration. Glidewell Laboratories is happy to assist your office with fabrication of custom impression trays, as well as our very own Capture VPS impression materials.